Hi friends, today we will be discussing about the myocardial infarction. In commonly we know as myocardial infarction as the heart attack. So what is heart attack? So heart attack is the decrease or the stoppage of blood flow to the heart or the myocardium. So what happens? The coronary arteries are there which supply blood to the myocardium. So coronary arteries are there for the circulation of heart within the heart. So there are right and the left coronary arteries. So what happens in myocardial infarction? There is the blockage of there is some blockage in the coronary arteries. It may be in the right or the left coronary arteries. So the blockage is mainly because of the atheroma, which we have discussed in my video in the atherosclerosis. So the atheroma forms in the coronary arteries mainly of plaque. So blood cannot go to the heart, and there is the ischemia because of the heart attack occurs. So there is no blood supply, so blood doesn't pump, and so the blood doesn't pump. So there is a damage to the heart muscle because of this. So this is we commonly called as the heart attack. So now we will move on to the causes and risk factors of the myocardial infarction. So first one is the age. The people more than 45 years of age prone to have the myocardial infarction. The second one is the tobacco. Tobacco chewing for long period of time may be the risk of the myocardial infarction. High BP. So in high BP, the blood vessels get damaged. So because of that also the myocardial infarction can occur. Uh, Fourth one is the obesity. The fifth one is the family history of the myocardial infarction. So if the family members are having MI, so there are chances for the person to get MI. Lack of physical activity is the sixth one. The seventh one is the stress, and the eighth one is the high blood cholesterol. Means if there is the more blood cholesterol, if there is the more cholesterol in our blood, so the person can get the myocardial infarction. So now we will move on to the symptoms of the myocardial infarction. The first one is a nausea, indigestion, and heartburn. The second one is the shortness of breath. The third one is the cold sweat. The fourth one is the fatigue, and the fifth one is the left hand pain. So in myocardial infarction, what happens? If the blood stops pumping, or there is the uh, pressure, or there is a pain, so the pain radiates to the left hand. So these are some symptoms of myocardial infarction. So there are two types of myocardial infarction. The first one is the ST elevated myocardial infarction, means there is a complete blockage in the coronary arteries which supply blood to the heart, and the second one is the non ST elevated MI. In this there is a partial blockage to the in the coronary arteries, which can be treated with percutaneous transluminal coronary angioplasty, which we will discuss later. And in STEMI we have to do the CABG. That means the coronary artery bypass graft, we commonly known as the bypass procedure. Now we will focus on to the CABG, the procedure which we do in the complete heart block. So there is damage of the coronary arteries. So we take the vein, the saphenous vein from the legs, and we join through the aorta to the artery where the blockage has happened. So there is the internal thoracic artery which can be take, the saphenous vein which I have written over here, the right gastroepiplaque artery, the occasionally ulnar artery, the splenic artery, and the inferior epic. Now we will focus on to the PTCA, that is the percutaneous transluminal coronary angioplasty, which we commonly known as angioplasty. So anesthesia is given in the groin area. Suppose this is a leg and anesthesia is given here. So doctor inserts needle in the femoral artery. The doctor insert a guide wire through the needle and removes the needle with introducer, an instrument with two ports for inserting flexible devices. So original wire is replaced by a thinner wire. Once it's in, the doctor guides it to the aorta and removes the guide wire. So the guide wire is removed, and so the balloon is inflated. So there is more passage for the blood to flow after that. Now we will focus on the medical management of the myocardial infarction. The first one is the morphine. So this is the high drug analgesic. The second one is the oxygen O2. Third one is the nitroglycerin, and the fourth one is the aspirin. So there are anticoagulant, antiplatelet agent, angiotensin converting enzyme inhibitors, the angiotensin 2 receptor blockers, the beta blockers, vasodilators, and diuretics, which comes in the medical management. We give according to the patient condition. So these are the treatment therapy. So now these is the short video I have make. Hope this will help. Thanks a lot.